Welcome to Medicine Handy Point. Today, our topic of discussion is to take history from a patient presenting with weight gain. So, briefly, what are the causes for the weight gain? There are metabolic causes, fluid retention causes, drugs, and others. So, in metabolic, always remember the Cushing syndrome, hypothyroidism, polycystic ovarian syndrome, insulinoma, and hypothalamic diseases. They causes weight gain. So we should be knowing them, and they are very common diseases. Fluid retention, congestive cardiac failure causes fluid retention, weight gain, nephrotic syndrome. Again, there is weight gain because of the low protein in the serum, and the fluid oozes out into interstitium and causes weight gain. CLD, again, there is no albumin production, so it again lead to weight gain by the fluid oozing out of the vessels. Drugs, insulin, sulfonylurea, oral contraceptive, antipsychotic medication like olanzapine, clozapine, and risperidone causes weight gain. Tricyclic antidepressant like amitriptyline causes weight gain. Anti-epileptic medication such as valproic acid and carbamazepine causes weight gain. Other causes are abdominal and pelvic mass, primary obesity, pregnancy, and nicotine withdrawal. So smoking history is important. So we ask about the onset and the duration because acute onset of weight gain is most likely fluid retention. So onset is important in that context. If it is progressive in nature, then most likely some other causes. But acute onset is almost always fluid retention. Then we will ask about duration, for how long the patient is having these symptoms. Then characteristic of the weight gain, how much you have gained weight in how much time, and did you actually weight yourself, or you just presuming that you have gained weight by the change in size of your clothes. So then we will ask about the distribution of the weight gain. As weight gain because of the nephrotic syndrome, usually the patient will be having periorbital edema in the morning and pedal edema. Ascites occur late, while in cirrhotic ascites occur first, and while in heart failure there will be generalized anasarca. So distribution of the weight is important. Then we'll start asking question about the causes of the weight. So we'll ask about CSF, CLD question, nephrotic syndrome question. Then we'll go into metabolic causes, if it is chronic weight gain. So Cushing syndrome, hypothyroidism, insulinoma, hypothalamic disease, and polycystic ovarian syndrome should be asked if it's a female patient. Then ask question about ask the patient, if it is female patient, whether there is chance that you may be pregnant. So pregnancy also causes weight gain. We'll ask about the diet, what the patient is eating, what kind of diet, because the fast food diet like burger, cheese, pizza, it leads to weight gain. We'll ask about any psychiatric condition and use of psychiatric medication because they causes weight gain. Past medical history includes asking question regarding the disease which can cause weight gain, which we have discussed above. So then family history should include is there include asking whether other family member are having the same weight as you got, because familial obesity is also one of the differential. Medication history, as we discussed previously, that anti-diabetic medication, insulin, steroids, OCP, antipsychotic, anti-seizure medication, they all causes weight gain. Social history, so smoking and nicotine withdrawal can cause weight gain. Alcohol causes hypoglycemia and weight gain. We'll ask about the physical activity of the patient, whether the patient is having active lifestyle and still gaining weight, so there will always be a cause for that. But if the patient is having sedentary lifestyle, so maybe it's the poor physical activity leading to weight gain. And then we will ask about the social impact of the weight gain on his lifestyle, like whether he is able to attend washroom, wash himself, and can do the rest of the activities at home and workplace properly, or he is facing difficulty because of the weight gain. I hope you like the video and please subscribe to the channel.